It is one of the factors that it should be considered when considering shutting down society in order not to overwhelm the system. And I think your point is valid in that regard. But there are many other considerations that need to be made. And I don't believe that was the primary reason that, that governments shut down everything. I think it was certainly one that was driving it. And people have spoken about flattening the curve. I don't particularly like that term myself. I'd rather we go for trying to be a bit more ambitious, not just spreading disease out over time, but as we do that, trying to reduce the ultimate impact of the disease and actually not just flattening this thing down and experiencing it for a terrible amount of time, but at a level at which we can bear. But we're a little bit more ambitious in our public health objectives in trying to truly suppress the disease and do, like Maria said, countries like New Zealand have managed to achieve. And actually get to zero. Not very easy, very, very complicated in many, many countries because of so many contextual factors around population, poverty, connections with other countries. So this is a very difficult thing to achieve. But in terms of the factors where I believe that many countries, as the disease accelerated, and as it became very difficult to understand the transmission dynamics, who was infected, who was not infected, the absence of systematic testing for suspect cases, I think many countries just could not see where the virus was. And we're seeing their hospitals fill up. And they look at these two factors. We know our system is coming under pressure. We know this disease is spreading. We can't see the virus. We don't have the testing. We don't have the contact tracing. We don't understand where this disease is, but we need to protect our society. And it's not just about protecting the health system. Ultimately, it's about saving lives. And an overwhelmed health system saves less lives. How do we reduce the damage? How do we reduce the health consequences of this? If we allow the system to become overwhelmed, the situation will even get worse. More people will die because they will not get any care or any intensive care. And I think many governments around the world were faced with very difficult choices. Very difficult choices. Some of governments made that call early. Some governments made that call later. Some governments shut down all of their society. Some chose not to shut down everything. Some chose to continue with their public health surveillance and try to persevere with the public health measures. Some gave up on that because they felt it was untenable and unmanageable in the context of the fire they were fighting. So I believe the decision in each country was unique to the context of the country. I don't believe there was a one-size-fits-all. I don't believe there was a single algorithm that anybody used. But I think while it's partially true that governments shut down because of fear of the health system becoming overwhelmed, I don't believe that was the only factor that governments considered. And in situations where governments could see where the virus was, where they had a good handle on how the disease was transmitting and who was getting it, they were less likely to have to shut down the whole system. Again, history will tell who did that at the right time and in the right combination. But certainly it would seem, at least on the face, that governments who acted early, governments who acted comprehensively, governments that acted with cohesive, comprehensive responses tended to flatten that curve, protect their health system, and are emerging now in good order from at least this wave of the pandemic.
Yeah, thank you. I will just add briefly to what Mike said, and then I will move to another follow-up question that we just received. When countries resorted to lockdowns, social distancing, and so on, and as you said, masks and so on, the hospital capacity could be one, but it varies, as Mike said, from country to country, and many countries actually were aiming to suppress and control the epidemic itself. And they used the lockdown or social distancing to strengthen their testing, tracing, and quarantine, and suppressed and controlled the virus. And there are many reports, as you know, some countries are now not seeing even cases. So it can help in addressing the overwhelming whatever situation we have seen in some countries in the health system. Helped in addressing the number of cases that was flowing to overwhelm the hospitals, but at the same time, when you use it to strengthen your testing, tracing, quarantine, you can also suppress and control. So as Mike said, it can differ from country to country. And our advice has been actually for countries to use the lockdown and social distancing to hone and strengthen their public health capacity, the testing, tracing, quarantine, with the aim of suppressing and controlling the virus. And still that holds true, and we encourage countries to move in that direction. Then on the follow-up question from Helen, I think there was a specific part of it which I didn't address, if we're receiving money for the Ebola in Western DRC from the US. As I said earlier, we have discussed with Secretary Adar to cooperate in helping DRC, but I didn't say, or we're not receiving funding directly from the US. But I said it many times, I think in our relationship with the US, it's not about the money, working together, the relationship, I think is more important, and hope we will work side by side to control or contain the outbreak in Western DRC as soon as possible, but the cooperation doesn't involve the financing part directly to WHO. Thank you.
We will conclude this press briefing with this last answer and clarification. We will have an audio file sent to you very shortly, and then transcript will be posted tomorrow. I wish everyone, I understand that Dr. Ran has...
No, just a clarification, because I said 12 cases of Ebola in Equator province in DRC. That's 9 laboratory confirmed and 3 probable cases. And what I mean by we're very confident that those probable cases, given their epidemiologic links with confirmed cases, but some of these people obviously cannot be tested because they're no longer with us. So 12 cases the WHO has of, and the country have of Ebola, of which 9 are laboratory confirmed and 3 are confirmed as probable cases based on their epidemiologic link to confirmed cases.
Thank you very much, Dr. Ryan, for this clarification. So I wish you a very nice evening to everyone.